buenas tardes a todos y bienvenidos al Foro de Negocios Forbes 2021. Este espacio en el que analizaremos brevemente las perspectivas de los negocios para 2022 desde diferentes campos. Y precisamente ahora vamos a tocar un punto muy importante, y es que el COVID-19 y la pandemia van a seguir generando incertidumbre en los negocios. Por eso es necesario vislumbrar lo que las autoridades de salud ven al respecto. Para ello hemos invitado al enviado especial de la Organización Mundial de la Salud para el COVID-19 a nivel mundial, el Dr. David Nabarro, que nos va a atender para responder una pregunta que seguramente muchos están haciendo, y es ¿hasta cuándo va a seguir jugando el COVID-19? En esta oportunidad David nos atiende desde sus oficinas en Ginebra, Suiza, y esta entrevista pues se llevará a cabo en inglés, por lo que voy a cambiar a este idioma. Podrán seguir la entrevista con subtítulos en español en nuestro canal de YouTube. So, David, thank you very much for accepting this interview. Welcome to Forbes Colombia once again. And it's a pleasure to have you with us again.
My pleasure.
Perfect, David. Now, I would like to start by asking you a question that is worrying practically all the world. And it's what we're seeing in Europe. The cases are rising in Europe and other regions around the world. So what would we need to end the pandemic right now?
Well, I think we're a long way away from the end of the pandemic. Typically, a pandemic will end when there are not many susceptible people for the virus to infect. And at the same time, when the virus itself has weakened in its potency and is spreading without killing people or making them seriously ill. Right now, this particular virus is still quite ferocious and causing a proportion of those it infects to have serious illness. And right now, there are still large numbers of susceptible people in most parts of the world. There will be some locations where we will see, thankfully, a reduction in the size of the surges that occur. But in general, I think we're some way away from the point where this pandemic is even starting to end. I'm not prepared to say when it will end, because it's an almost impossible thing for somebody like me to predict in a way that is likely to be true. So it'd be quite a high risk. But the summary is we're still in the midst of the pandemic. There are still a lot of susceptible people in different parts of the world. So I'm at least preparing for it to continue for some years from now.
Okay, David, now I would like to talk about the global crisis supply. And I mention this because it's affecting directly to the COVID vaccines. The World Health Organization said that this crisis could create a lack of needles that will be necessary to apply the vaccine. So if this crisis goes longer and longer, how would this fight against the pandemic be affected?
Well, at the moment, we are in a situation where there's heavy use of needles and syringes. And there are places where supplies of syringes are low. My own view is that that will be short-lived and is unlikely to be a major deterrent to the overall supply. After all, syringes are always going to be needed. And so if there's a shortage, it's necessary to increase production. The much bigger problem is shortage of vaccine supplies. And I'm going to say that the system that exists for moving vaccines into developing countries, called COVAX, has got a supply shortage problem, and it's particularly to do with the predictability of supplies. And that's the one that I'd like to see overcome as quickly as possible.
Perfect, David. Now I want to talk about how this fight against the pandemic is going in terms of equal access to the vaccines. We're seeing now that the United States and the European Union have most of the population with both doses of the vaccine, but it's not the same in Latin America and Africa. So what can we do for having a fairer vaccination in 2022?
The most important requirement is that the COVAX scheme receives the vaccines that have already been pre-ordered on its behalf. There seems to be a situation right now where COVAX is not receiving vaccines that have been ordered, and instead vaccines are going to governments. It is rumored because the governments are paying more. And for me, the most important requirement is that the pre-existing COVAX orders are respected and that the program receives vaccines that were ordered some months ago, because there are countries that are waiting for vaccines that can't receive them because COVAX is not able to benefit from a predictable supply. That's the biggest problem.
Okay, precisely regarding COVAX, David, can we say that its work on delivering vaccines in Latin America and all parts with low access to the vaccines has improved?
Well, COVAX is a mechanism for routing vaccines to countries that need them. And COVAX can do that job if it gets the supplies that it requires. If it doesn't get supplies, then COVAX is unable to perform the role expected of it. During the last few months, COVAX has not been able to get the supplies that it was due to receive. This is because, I understand, some countries have gone to the manufacturers and have managed to get vaccine that should have gone to COVAX, and that in turn damages the system that is getting vaccine to the world's poor nations.
Okay, David, now during G20 and COP26, there have been some pledges in order to have an egalitarian process on the vaccination around the world. So do you feel optimistic about these pledges to become a reality?
Oh, we are in quite a difficult situation in our world about fairness. You mentioned COP26. The big anxiety in COP26 is that the richer countries promised $100 billion a year to poor countries to help poor countries to reduce risk associated with climate change, and also to be able to make the shift from fossil fuels to other sources of energy. But that money has not been forthcoming. So poor countries are feeling that the rich world tends to promise and not to deliver. I think that then we might have a similar situation about vaccines, again with the rich world through the G7, through the G20, making promises that are not delivered on. And I think that this is a pretty massive issue. Mistrust in global affairs is really a serious situation, because so much has to be done on trust. If somebody gives you their word that they're going to give you 5 million doses of vaccine in the next month, if you then go ahead and organize with the people to vaccinate 5 million within the next month or two, and then the vaccine doesn't arrive, you've got a terrible mess on your hand. Basically, you are left with a huge loss of trust and confidence on the part of people. So if the rich world keeps letting down poor countries, the impact is a very serious one on the trust that people all over the world have in the rich countries. And it even impacts on the trust between people and government in poor countries. And the loss of trust between people and the state in regard to an issue like COVID-19 is a really serious thing to happen. You see, the virus is the problem, people are the solution, and people can only perform well if there are trusting relationships between them and the state.
Okay, David, now that you mentioned this topic, how can we analyze the relationship between state and society during this vaccination process?
Well, it's never homogeneous, okay? So a state will have a relationship with the people in that state, but it will vary hugely depending on the interest of different groups of people. Sometimes those with a specific ethnicity will have a high level of trust for the government because perhaps the head of state may have come from that particular ethnic group. And so we must always remember that there are factors that are peculiar to individual situations when making an assessment of trust. But in general, particularly in countries where there have been a lot of shifts in the instructions given to the public about what should be done, there can be a loss of confidence and trust. But other countries where there's been very regular dialogue between the state and the people, and where decisions are always carefully explained, and indeed where all levels of leadership respect the line, and you haven't got one rule for the bosses and another rule for the ordinary people. In those situations, things have gone and are going really well. I don't like picking up individual countries, so I just say countries that have a tradition of good and respectful relationships between the state and the people are the countries where things are going really well. Countries that have a tradition either of total mistrust or mistrust among some sections of the population and the state, then things are much worse. And that's those situations where there is partial or complete mistrust among the population when the relationship with the state is being described. Those situations of mistrust are the ones where, in my experience, advancing on pandemic preparedness and response has been particularly difficult.
All right, David. Now, with the recent happenings that we have been witnessing around the world, there are some doubts about the effect of the vaccines in order to defeat COVID by themselves. We're seeing that in Austria, we're having confinements for the non-vaccinated people. Some regions of Germany are doing the same thing now. So there are some concerns about the fact that the vaccines by themselves won't be able to defeat COVID. So what can we do there?
Let me start by talking about strategy for dealing with a pandemic that is quite strong, as this one is at the moment. And it's incredibly difficult to vaccinate out of a pandemic. Vaccinations on their own will usually not do the job because they're not 100% effective. The protection wears off over time. And in most cases, the virus is constantly mutating. So it means the virus might beat the vaccines. And so WHO is very clear. Don't rely on one method of prevention. If you do, you might well end up in trouble. So we say, practice a variety of interventions. What we call personal protection is in one group. Public health is the next group. And then community-wide responses is the next group. Let's start with personal. Personal includes wearing a well-fitting face mask and doing that so that you prevent others from being infected if you are carrying the virus, or so that others if others are carrying the virus, they're less likely to infect you. We now are very clear. These surgical masks are the best way to go. Make sure they're tight-fitting over the nose. There's a metal strip in there, and you really want to get that good and tight. Make sure that the mask is properly covering both sides of your face. Do not go around with the mask like this. It's worse than useless. If the mask is wet, you need to change it. You should change your masks frequently. I invite people to also pay a lot of attention to disposal, just simply because it's not a good idea to leave masks lying around. It's interesting just how many people really don't like wearing masks. I'm being clear that I think that even vaccinated people should be wearing masks when they're close to others, especially in non-ventilated settings. I also encourage people always to move around in ways that enable them to avoid inhaling the air that has been exhaled by others. That's why we do physical distancing. We don't do it just because we don't want to be with people. We do it because we don't want to breathe in their air and the droplets in their air. So I'm quite clear, avoid inhaling the air breathed out by others. Number 3 is good hygiene is essential. Coughing into your elbow, avoiding messy sneezes, washing your hands and surfaces often. Number 4, protect those who are most at risk. People with diabetes, people with heart disease, people who are older, health workers, and all the rest. One good way of protecting them is by vaccinating. And so use the vaccinations not to try to vaccinate everybody, but use them to save the lives of people who are most at risk. We've got wonderful data from all over the world that show that vaccination saves lives. So that's the personal side. Then the second part is public health. And that's making sure that if there's a cluster of cases, you go in quickly and early to reduce the transmission of infection, and at the same time, to make certain that if people have been contacts of others who are infected, you isolate them as well as isolating those who've got the disease. You isolate people with disease, you isolate the contacts. And isolation is absolutely critical. Third is if there is an outbreak surging away, then you do need to be able to encourage people to stop moving. You don't do lockdown, but you restrict movement, particularly in the area where there is a lot of disease. That combination of personal protection, public health, and dealing with outbreaks and containing them quickly is the 3-pronged strategy that should be used. But you will hear very clearly, for me, vaccination is just one part of the total response.
Okay, David, now one of the measures that has been implemented recently in every country from France to Italy, even in Colombia, has been the COVID pass in order to access to any public place such as a restaurant, a movie theater, etc. So many people is concerned about this, mostly the non-vaccinated people, because they say that it's restricting their freedoms and things like that. So do you think that this measure is correct in order to tackle COVID somehow?
Well, there will always be governments who really do want to see vaccination passes used because they want to do everything possible to encourage everybody to get vaccinated. If they don't create a bit of an advantage for being vaccinated, then it's going to be hard to persuade people who are reluctant to do it. So this will be an approach we will see. Personally, I really do not want to express a view on it. I want to stress this is a view that only people in government can take and should take, and people like me who are offering advice should offer our advice confidentially on this kind of issue to a government. At the same time, I want to tell you and those who read what you write that vaccines are stopping individuals from dying of COVID. They are doing a remarkable service. I'm sure that that there's anxiety for some people associated with vaccines. But I'd just like to say that I have noticed that being vaccinated does enable people to move around with a lot less anxiety than if the vaccines weren't available. So I can understand governments putting quite a lot of pressure on it. What I prefer not to see is compulsion on vaccination, because that really does make certain groups of people extremely upset. And I don't want there to be a lot of distress associated with COVID. Dealing with COVID means all of us working together and pulling together. And that's harder to do if you've upset people through extreme coercion. I don't think a vaccination pass, by the way, is coercion. A vaccination pass is a way of ensuring people who are vaccinated can take advantage of it for getting on with life. And so, just so you know, I'm trying very hard not to take a position on it. Over.
Okay, David, now let's make an analysis of how the pandemic has gone so far. For the end of the year, the World Health Organization has predicted that around 40% of the population will have both doses of the vaccine. And for mid-2022, the goal of 70% of the population with both doses of the vaccine will be reached. Do you think that we can reach this goal with the rhythm of vaccination that we're having so far?
There are various targets. There's a target of 10% by September, I believe, then 40% by early next year, then 70% by later next year. And the world is not hit the 10% target. And that's not because of a shortage of a lot of vaccines through COVAX. It's a shortage of about 500 million doses, which is 10 days of world production. My basic view is these targets will not be reached unless there's a collective decision by all world leaders to ensure that COVAX gets the vaccines that it was supposed to receive. Because what's happening right now as countries start to implement booster doses is that rich nations are just forever taking vaccine deliveries away from COVAX. And that in turn means that vaccine is going into the stores of the rich countries and not going into the arms of people in poor countries who need to be vaccinated. Overcoming this problem is all about collective discipline by the leaders of nations so that they together respect the position that COVAX has had for some months in the vaccine procurement queue. It is really not acceptable, in my view, that some countries seem to be pushing their way in front of COVAX. In fact, I'd like all nations to defer taking deliveries for some weeks so that COVAX supply line can get filled up. Then we move towards fairness, which is where we should be.
Okay, David, now I want to finish this interview by asking something that Dr. Tedros said a few weeks ago during the G20 and COP26. And it was that the world should prepare for more pandemics besides COVID-19 in the future. So how are we prepared for a future pandemic after we have seen of COVID-19? The way that the world has dealt with this has prepared us for a future pandemic, or we need to improve in some other areas to face another challenge like this one?
Thank you. Let me just finish quickly. If another pandemic came along tomorrow with a virus similar to or nastier than the present virus, I think it would be very difficult for the world to deal with. The nature of the relationships between governments and then between governments and employers, governments and local authorities, governments and professions, governments and civil society, these relationships are still not strong enough and predictable enough to deal with an issue like a pandemic with the level of efficiency that I would like to see. So an updating of the relationships between countries is desirable. And one of the things that Tedros and WHO are working on is a new agreement that would mean that future pandemics are dealt with better than this one's being dealt with. And that will be worked on in the World Health Assembly in the coming weeks. I'm very pleased that that's happening, and I very much hope that it will lead to a new agreement.
Perfect, David. Thank you very much for your time and shared knowledge in this brief space of the Forum of Forbes 2021. Y a todos los que nos acompañaron en este espacio, muchas gracias por estar conectados y los invitamos a que no se despeguen y a que sigan viendo los contenidos que tenemos preparados para ustedes en este Foro de Negocios Forbes 2021, que se vienen sorpresas muy chéveres. Muchas gracias y continúen con nosotros.